we're gonna do a head to toe assessment. Can you tell me your name and date of birth?
Maureen Madra, 2 3.
Okay, I would check her wristband. Do you have any allergies?
Nope.
Excuse me. I would provide hand hygiene and put on some gloves if it was necessary. Okay, so I'll be taking your blood pressure today. I'll be doing a 2-step. I would expose the arm, make sure that I can see it. First one, I would pump it up and then I listen until I can't hear your blood or your pulse anymore. And then I will pump it up again to that amount, and I will listen to get blood pressure is normally 120/60, so I'll put it around there. And yeah. So next I would be assessing your apical pulse. So I would be going to the angle of Louis, and then I would be going over to mid-clavicular and then 5 intercostal spaces down. I would listen for 60 seconds, and the normal rate is 60 beats per minute, and I would expose the area to make sure that I was able to do that. Okay, I'm going to ask you a few questions about your eyes. Do you have cataracts? Do you wear glasses?
Yep.
Do you have dry eyes or anything like
Nope.
that? For your respiratory, I'm going to ask you some questions. Do you ever have a hard time breathing?
Nope.
Does it take a little excessive breathing to get caught up with your breath? And have you ever had asthma?
Nope.
Okay. Then I'm going to ask about your heart. Have you ever had any heart palpitations? Do you take any medications for
Nope.
your heart? And then have you ever had any symptoms of heart failure?
Nope.
I'm going to ask you some questions about your ears. Do you have tubes?
Nope.
Do you wear hearing aids?
Nope.
And do you have any ear pain?
Nope.
Okay. Do you know where you're at, or where are you at?
Southwest Tank.
What'd you eat for breakfast?
A graham cracker.
Good. Okay, so I'm gonna start by assessing your hair here. It's thick, there's no infestation, no abnormal bumps, and your scalp looks clean. There's not any abnormalities there. Next, I'm going to go to your sinuses. I'm going to do your frontal and maxillary sinuses. Any pain there?
Nope.
I'm also looking at the symmetry in the face. She has a few freckles on her face, so that's what I'd be assessing for any abnormalities, but they're not abnormal, so I wouldn't chart that. I'm looking at her eyelids, eyebrows. Can I have you close your eyes? I'm going to touch her eyelids here, make sure there's nothing abnormal there. All right, I'm going to start with your eyes. So I'm going to do the 6 cardinals. Can you follow my pen?
Mm-hmm.
I was looking for any tremors or anything in her eyes. There wasn't, and she followed my pen correctly. Can you tell me when this comes into your peripheral vision? I'm going to do 4 spots.
Yep. Yep. Yep.
Okay. And then I'm going to have you look at my pen and then look at the doorknob over there. I was watching your pupil dilation and responses, and that was normal. I'm going to check your pupils here. I'm going to look at one eye and shine it in the other. So they constrict, right? I'm going to do that again, but look in the opposite eye. Okay, so everything's normal there. Next, I'm going to move on to her nose. Can you do the farmer sniff for me? Okay, I'm going to look up into her nose, make sure there's no abnormal drainage or any deviations or anything like that. There's not. I'm going to move on to your face. Can I have you pull down your lip and pull up your lip? Okay, I'm looking at her gums, making sure that there's no abnormal color or blueness. I'm going to look at your tongue and I have you move it up and down. I'm going to look back in your mouth. And I'm looking at the tonsils and stuff back there. Everything looks normal. It was pink and there wasn't any blue or discoloration. Next, I'm going to move on to her ears. So, I'm going to bend her ear here, pull on it, and push in the tragus. I'm going to do the same thing on each side. Any pain with that?
Nope.
I would start in the ear that's not affected and move to the ear that's affected. If I had an otoscope, I would look in there and see the pearly tympanic membrane. And then I'm gonna assess her hearing. Can you tell me what side you hear this on?
The right side.
Okay.
Left side.
Perfect. Okay, I'm also assessing your skin throughout this assessment. It's warm to the touch, it's not clammy or anything, and not any abnormalities. I'm gonna assess for edema in her legs, and yeah, okay. So now I'm going, oh, and I would look at the peripheral veins, make sure that they're not popping out or anything like that. So I'm gonna assess her lymph nodes. If you want to zoom in.
Oh, yeah.
Okay, so I'm gonna start with her olfactory, then pre-auricular, post-auricular, and then submandibular, submental, anterior clavicular, post-clavicular, and subclavicle. However you say that. All of those were normal. There wasn't any inflammation in them, and there wasn't any abnormalities that I would have to report to the physician. Next, I'm going to assess her tragus and palpate her tragus. There isn't any abnormality there, so she is hydrated. I'm gonna feel her trachea. I'm gonna move on to her movements and joints and feel those. Is there any pain when I touch your joints? Okay, I'm also looking for muscle tremors or anything like that. Movements, I am going to do your sternocleidomastoid, okay, your traps, up. You put your arms out for deltoid, don't let me push them down, don't let me push them up. Now I'm going to do your wrists, down and up, push up. And then you put your fingers out like that, don't let me push them in, grab onto my fingers. I'm going to do your hips, adduction and abduction. I'm going to do your hamstring, I'm going to pull it away, quadriceps push in, and I have you push your toes to the ceiling and to the ground. Perfect. So there wasn't any muscle tremors, and each side was the same, so I didn't have to, there wasn't any sense of stroke or anything like that. Can I have you stand up and walk towards Megan? Okay. I'm also going to assess your, I'm going to assess your back while you're standing up.
Oh, sorry.
Can I have you bend over? I'm looking for scoliosis, sclerosis, and lordosis. You don't have any, so that's good. Not any signs of any of that. Now I'm going to move to your nails and your movements. Okay, so I'm gonna, the capillary refill's good, your nail beds are good, there's not any inflammation or anything like that. And, oh, can you stand up for me? I'm gonna push you and see if you can, if you're gonna fall. Okay, that's good. So I'm gonna assess your nerves. Can you close your eyes and tell me what you smell? This is the olfactory.
Alcohol.
Okay. I did the optic nerve when we did the 6 cardinals. I did the ocular motor when we did the 6 cardinals, and I did the abducive when we did the 6 cardinals. Can you smile for me? Okay, so that's your tegmental, or no, that's your facial. Can you touch your face for me? Touch your nose. That's the tegmental. Then for your ears, that's abducive. I did that when I was snapping on each side. And the vagus, can you go ah?
Ah.
I'll do your glossopharyngeal, that'll be the gag reflex after that. And then I did your tongue movements, which was a hyperglosseal when I was assessing your mouth. Can you stand, oh, I gotta do the Babinski test. I'm assessing to see if your toes curling. They didn't, but it's okay if you're under the age of 2. And then I'm going to have you do your hand movements. Can you go like this for me? I'm just doing making sure that her neural function is okay. Now I'm going to move on to the respiratory, abdominal, and cardiac assessment. So So I'm going to start by assessing your chest here and looking for lumps or bumps or anything like that. I'm also going to do that with your back. I would have her stand up and look at her back, but I already did that in the previous step, so I don't have to do that again. I would assess, this is 2 to 1, and she is normal there, so I'm going to have you turn around. So I would listen to I would listen to 16 spots. I only will have listen to 4 because otherwise you pass out. I'll show you them. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and 16. So I'll have you listen. I'll listen for a second. I'm gonna go up your shirt.
Okay.
And I will be doing that with the bell. Can you take a deep breath for me? Okay. Another deep breath. Okay. Another deep breath. Another deep breath. And make sure to expose her and take off all of her clothing so that I am allowed to assess. Make sure that she is that I'm listening to the right spots. I'm going to do the W on this back. Watch for her chest expression. It's equal on both sides, so that's normal, and there's not any abnormalities there that I would have to report to the doctor. I'm going to spin you around again. I'm going to assess the chest again, make sure there's no abnormalities. I would listen to 10 spots. I'm not going to do an exposure, but I'll just show you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So those are all normal. I'm not going to listen, but I would listen to a normal respiratory, or there wouldn't be any crackles or any abnormalities. Next, I'm going to move on to her chest. I would palpate again, make sure that there's no abnormalities or anything like that. I would start over on the acordium, precordium. I would go down with her ribs, intercostal spaces, go down one. Go down to Erb's point, and then I'll go to mitral and tricuspid valve. Erb's point is where S1 and S2 are heard best, and I would listen to those without her pulling, but since we're taking a video, I'm not going to do that. Next, I'm going to listen to her carotids with the bell. Okay. So those sound normal. I would listen to them for 60 seconds. I'm going to touch her peripheral pulses, so do the temporal, carotid separately so she doesn't pass out. Brachial, radial, femoral, popliteal, posterior tibialis, and dorsal pediis. I'm assessing all those for 60 seconds, and I would make sure that they're even on each side and there's no abnormalities there. And I will assess the jugular vein to make sure that there's no jugular vein detention. If there was, I would make sure to sit her up to 45 degrees. Next, I'm going to do her abdomen. So she would be laying back with her knees up, and I would be looking and touching her abdomen, assessing the skin throughout, making sure that there's no abnormalities. I would have her raise up her head and raise up her head and make sure that she did not have anything's popping out. And then, did you go to the bathroom for this?
Yep.
Okay. So I'm gonna listen to her 4 quadrants. I heard normal bowel sounds in each one, and if they weren't normal, I would have to listen to 5 seconds and
Sorry.
position. I'm gonna assess her vascular sounds, so aortic, iliac, renal, and then I would do her femoral, but not since we were taking a video. Next, I'm going to palpate. I'm listening to see if there's any blockages in there or anything like that, and then I'm going to push down my fingers 2 inches, feeling for any abnormalities, sorry. And then I would have her sit back up and ask her if there is anything else that I can do for you. I have time.
No.
Okay.